Hey, did you ever hear about nurses getting attacked in hospitals?
No, not at all. How about you?
No, I haven't. Well, I'm a retired police officer, and but we didn't have any hospitals in my jurisdiction. But I'm next to a big city, and I have heard of incidences where nurses or emergency room personnel were attacked, if you want to call it that, by the patients coming in for whatever reason, overdrugged, alcohol. They've already been in an abusive fight, and they come in, and now the caretaker turns out to be against them also, and so they're out of their common mind. But as for individual cases, I don't remember any other than from different reports, because we have to have reports all the time as you're coming into your next duty shift. But I never had to arrest anybody or go to any assistance or any hospital, because we didn't have any hospitals in our jurisdiction.
I had a friend that was attacked. She wasn't in the emergency room, but she was in a cardiac care unit, and a patient jumped up and attacked her. I think that hospitals should have better security, male and female, to protect the nurse against a female or against a male attacking them, and some sort of security that the nurses can be protected. And someday maybe even some video surveillance to be able to identify people that are hurting people.
I do know at Lawrence General at nighttime they walk someone out with the nurse after she finishes her shift, because sometimes it's not safe out there. But
If there was an altercation with that
Right.
patient on her shift, not as a general practice, right?
no,
All
they
the
do
time
it. They do
all
it
right.
right.
Because I know that Lawrence General is the one that's closest to us, and they have a security staff, but no weapons or anything involved, and but they're there just keeping an eye on the general public. But anytime they have a altercation, they immediately call the local police department. So, but I mean, as for the intermediate type guy or the security guard type thing, that's what they have at the hospital that I'm aware of. And then they call the police department of the town or city that they're in.
I know. Now, what happened to your friend? Was your friend able to get that person arrested?
No, somebody came in and sedated the patient that was attacking her, but that never went any further, and it's just not fair. You're there to service them and take care of them, and for them to be any nurse, male or female, to be in danger or to be afraid sometime to go to work.
Was it that the patient was under the influence of
No, he was a
Something?
heart patient, and he was agitated, maybe by some medications that he was taking for the heart, or he didn't like her answer to a question, and he just lunged at her, and she was scared.
Well, what do you think they could do? You think, now, the hospital is under the responsibility of the owner of the hospital. A lot of hospitals are owned by a conglomerate of 1, 5, or 6, 7 different hospitals. Have armed guards where normally any stories that you've heard, and I haven't heard a lot of them, but I have heard some. It's in the emergency ward.
Yes.
It's not so much
More
unless
so in the emergency
somebody.
room. I know on the weekends at the emergency rooms near our house, I think there is a definite security person that is walking constantly around. Even people waiting to be seen get very belligerent and angry and will lunge out at you because they're sick and they want more care, or they want to be first. And I know I've seen security people walking around just as a protection.
Yeah. Well, my thing is, I was shocked because I personally had never heard of it. But we deal with a lot of EMTs and everything. When we go back to Massachusetts, I'm going to ask some of them, is this something that's regular practice or what? See what could be done.
Either it's going to be trying to come up with something through the insurance companies that's part of the for that salary of someone. It's got to have someone there 24/7 in the emergency, if that's where all these cases are. Maybe more documented to them. but a lot of the hospitals don't document these things. It just, you know,
They
it goes
keep
by the
quiet?
wayside.
Mhm.
They keep it quiet or
Quiet.
whatever, so they don't wanna have any bad vibes coming out into the public. But again, I think it's
Yeah.
something should address, because everyone deserves to be protected.